We are 6 weeks away from Kentucky's primary election coming up May 21st. And I want to remind you, you have 2 more weeks to register to vote if you haven't done so already. There are 4 Democrats running for governor, hoping to be on the general election ballot in November. And among them is State Attorney General Andy Beshear. It's nice to have you today.
Thanks for having me. Being in Bowling Green is always great. You may know that my mom is from Bowling Green, so I consider this a little bit of home.
And I told you, Miss Jane Beshear has been here at WBKO before.
She has.
And so let's talk about some of the issues you're focusing on in your campaign. Many of the things you've talked about as Attorney General. We'll start with health care. That's something you've come out with a comprehensive plan. What do you think is really important with health care? Now, we've seen a lot of changes since the Affordable Care Act President Obama implemented, and then we've seen some rolling back of that in recent years.
Well, I believe that health care is a basic human right, and that every Kentucky family ought to be able to have quality, comprehensive coverage, and we have to lower the cost for everyone out there because everybody pays too much. So our plan has a couple parts. First, we're going to make sure that we have the most important protections put into state law. In other words, health care companies shouldn't be able to kick you off your coverage for a pre-existing condition, because half of all Kentuckians have a pre-existing condition. Everything from diabetes to asthma to acne are all considered pre-existing conditions. Second, insurance companies shouldn't be able to discriminate against women and seniors. They should never be able to charge them more. Third, you can't have a lifetime cap, which they used to try, because a child with a debilitating disease would run out of coverage so early. Second piece of the plan focuses on expanded Medicaid, because that's the help the working poor need. They're willing to leave their home for a job that doesn't pay them enough to afford health care coverage, and this has provided health care coverage to over 500,000 Kentuckians for the first time, and it's the main funding for rural health care coverage. But the third piece is lowering costs for everyone, and it's starting with prescription drugs. No more EpiPens where you have 20, 30, 40% increase. And then we're going to use our buying power as a state on the Medicaid side. We're one of the largest purchasers of prescription drugs to push those costs down for everybody.
And so we talk a lot about improving affordability, accessibility for a lot of low-income people, the disabled, seniors. So I would consider myself middle class. I'm fortunate to have an employer insurance plan. It costs me $200 out of pocket every time I go to the doctor till I meet that deductible. I mean, don't you agree? That's too expensive.
It is. Everybody pays too much. It doesn't matter what you make right now. You pay too much. And it's a number of things. Prescription drugs drive it. But what about that surprise billing? Our plan is going to outlaw those bills where they don't tell you you're out of network. In fact, they told my wife that they would call us if a certain testing she was asked if she wanted to do while under anesthesia was out of network. I never got a call. I opened up a $10,000 bill, and that happens all across Kentucky. Under our plan, that would never happen. And you shouldn't be charged for so many things you're charged for right now. If you go in for preventative screenings, under federal law right now, you shouldn't be charged. But the moment you ask one question that falls outside of that, what happens? You get that full bill. So we're going to make sure that we lower everybody's costs and that your coverage is meaningful. That if you are sick and you need to go to a doctor, you ought to be able to see a doctor. That's a part of my faith. That's a part of my morals. And I think every Kentucky child and every Kentucky family ought to have wonderful health care coverage.
I want to go back to Medicaid. You say you want to see it expanded. Our current governor, Matt Bevin, has worked on an overhaul of Medicaid. He wants to propose those work requirements. We've seen that be tied up in the courts. I mean, do you agree that people should have to work if they're able-bodied to get Medicaid coverage?
Well, I believe that health care coverage is a basic human right, and we are better if everyone is covered. But these are all pretexts by the governor, who's trying to tear health care coverage away from over 90,000 Kentuckians. And if you're on expanded Medicaid, you're already the working poor. You're not on regular Medicaid because you're working. You're out there trying to make your situation better, and all this governor's trying to do is create paperwork where if you don't fill it out appropriately, you get kicked off. That's why Arkansas's plan has been frozen. That's one of the reasons this plan isn't going forward. But I'll tell you another thing that's harmful is there are attempts to put copays in. Copays won't make the state any amount of money, but if you don't make them on time, you get locked out of your coverage for 6 months. Now imagine that friend, because we all have a friend or family member suffering from addiction. They may have the money to make a copay, but that doesn't mean if they're suffering from addiction that they're going to be able to get that in or get it in on time, and suddenly they'd be locked out of coverage and not have treatment for over 6 months. Facing this drug epidemic, we got to be better than that.
Okay, you talk about addiction, the drug epidemic. As Attorney General, you filed some big high-profile lawsuits against pharmaceutical companies. Where are we in fighting the opioid epidemic right now?
So I've become the most aggressive Attorney General in this country at suing these companies. They made hundreds of billions of dollars in profits while our people died. So I've sued 9 of them. We've kept them all in state court, and we have defeated every motion and every argument that these companies have made. We have won everything thus far. And why is that critical? Because if we have that one potential transformational moment with every dollar for treatment, for recovery, and for prevention, so no one falls into addiction in the first place, I want to make sure we don't just have a seat at the table, but we have the very first seat. And right now, that's where we are. And I'm the dad of an 8- and a 9-year-old. This epidemic scares me every morning and every night before I go to bed. I want to put this behind us in our lifetime so my kids and these kids here today don't have to face a world this dangerous.
It's been detrimental to a lot of families, that's for sure. All right, something else that's been a big issue this legislative session, the pension crisis, right? We've seen teachers rallying in Frankfurt. We've seen different bills presented to try to shore up those pension funds. What ideas do you have for doing that?
Well, our pension crisis is a crisis, but underneath it all is a promise that we made to our teachers, firefighters, social workers, every state, city, county, and school employee that don't get paid enough but choose a life of service and have to work decades to qualify for that pension. The problem with this administration is the only thing they're willing to do is to cut those benefits and break that promise. And I was raised in this state with Bowling Green and Western Kentucky values that you make a promise, you keep it. So let's add new funding. Let's make sure that the system can become healthy. Let's add new forms of revenue that don't raise anybody's taxes, like expanded gaming. We lose $550 million of tax revenue to states all around us right now. So a Kentuckian could bet not $1 more than they're currently, and we could put significant money into the pensions each and every year, and then teaching is still a viable option. Those people who are out there right now that say, I want to be a teacher, and know that we don't pay them enough, would still have that secure retirement. And I want the very best teaching our kids, protecting us in our communities, going into that home to serve the neglected. Our social workers, our public servants are amazing people. I want to lift them up, not tear them down.
You know, you said something about expanded gaming. That makes me think about your dad, who was governor. Your father, Steve Beshear, was governor for 8 years, and he was a big proponent of that. Has your dad given you any advice about running for governor?
Well, my dad and I, and my mom, we're all really close. I love my parents, and I think they've taught me to be a good parent. That's the nicest thing I can say about anybody. And sure, they're involved in this election. What I really need from them is more babysitting. I have an 8- and a 9-year-old. I'm on the road a lot. Mom, Dad, you know, play some basketball, hoop it up with them, take them to movies, and they spend a lot of time with them, but we could always use a little bit more.
I'm sure they are glad to help you with that, to do some spoiling, right? Thank you, Attorney General Beshear. We appreciate your time today. We do want to let you know he's running in the Democratic primary for governor. That's coming up May 21st. You can still register to vote by April 22nd at elect.ky.gov. And we also want to let you know we're inviting all gubernatorial candidates to join us here on Midday in the weeks leading up to the election.